Welcome to Have More Babies. Today we're diving into something that can cause some unexpected worry for new parents. But the good news is it's usually very manageable if you have the right information. We're talking about hyperbilirubinemia in newborns. Birth is amazing, full of joy, but sometimes medical things pop up and it can feel a bit overwhelming. So our mission today is really to clear up any confusion about high bilirubin levels.
Yep.
We want to help you understand what's important if, you or someone runs into this. We're drawing on top pediatric insights here. Okay, so let's just jump right in. What exactly is hyperbilirubinemia? Why does it often cause that yellow look, jaundice, that many parents recognize?
Right. So hyperbilirubinemia, it sounds like a mouthful, doesn't it? But it's basically just the medical term for when there are high levels of bilirubin in the blood. And bilirubin itself, it's actually a natural yellow pigment. It's a byproduct from when the body breaks down old red blood cells, kind of like recycling.
Okay, a yellow pigment from red blood cells, got it.
Exactly. And when those levels get too high, that yellow pigment becomes visible. That's what we see as jaundice, the yellowing of the baby's skin and the whites of their eyes. Often, seeing that yellow tint is the very first clue for parents. So understanding what it is, helps us see why it matters.
That makes sense. So it sounds like jaundice isn't just one thing. Our research pointed to a whole spectrum, like from totally harmless to potentially more serious.
Yeah.
Can you walk us through the different kinds? Because I imagine parents see yellow and just wonder, is this okay?
Absolutely. And that's a crucial point. Knowing the nuances really helps. So first off, there's physiological jaundice. This is by far the most common type. Pretty much almost every baby gets a touch of this. It usually shows up between day 2 and day 4. It happens because the newborn's liver is still maturing. It's not quite up to full speed yet with processing that bilirubin.
Okay.
Generally, it's harmless. And thankfully, it often goes away on its own, no specific treatment needed. So a little yellow early on, very common, usually no big deal.
That's reassuring.
Then you have breast milk jaundice. Now, this one can be surprising because it can last quite a while, sometimes up to 12 weeks. And it happens specifically in breastfed babies. It seems to be related to certain things in the breast milk itself that interfere a bit with breaking down bilirubin.
12 weeks?
Yeah. But the key here is, if the baby is feeding well, gaining weight, acting normally, this prolonged yellow often just needs observation, not necessarily urgent action. It's different from other types.
Okay, so that's different from, wasn't there another breastfeeding related one?
Yes, good distinction. That's breastfeeding jaundice. And it's easy to confuse them, but they're different. Breast milk jaundice is about what's in the milk. Breastfeeding jaundice is about not getting enough milk. Right? It's usually because of, inadequate intake, especially early on. If the baby isn't eating enough, they might get a bit dehydrated, fewer wet diapers, fewer poops. And since bilirubin mainly leaves the body through stool...
Less out means more stays in.
Exactly. Less output means it builds up. This type often signals, hey, we need to work on the feeding, make sure baby's getting enough.
Got it.
And finally, there's pathological jaundice. This is the one that signals something else might be going on underneath. It could be an underlying illness, maybe an infection, or even liver issues. This type definitely needs a closer look, a medical investigation to find and treat the root cause.
Okay.
So yeah, all involve high bilirubin, but the reasons why and what it means can be really different. Knowing that helps turn that worry into, informed action.
That's a great breakdown, like different shades of yellow telling different stories.
Yeah.
So building on that, what's actually causing these levels to go up? What's the why behind it all, from the totally normal stuff to the more alarming factors?
Yeah, it's fascinating, really. It's a mix of normal newborn physiology and sometimes other things that add to the load. The main natural cause is the breakdown of fetal hemoglobin. See, babies in the womb have a special type of red blood cell, fetal hemoglobin, great for getting oxygen from mom. After birth, those fetal cells start breaking down pretty quickly to be replaced by the adult-type red blood cells. This fast turnover makes a lot of bilirubin, often more than the baby's brand new, still maturing liver can handle right away.
So it's like a temporary traffic jam for the liver. Too much coming in too fast? Because the baby's literally changing their blood.
That's a perfect way to put it, exactly. The liver's just getting started. Then, beyond that natural process, other things can contribute. Like we mentioned, inadequate feeding is a big one. Not enough milk means fewer bowel movements, so the bilirubin doesn't get cleared out effectively. Also, preterm birth, babies born early, their livers are even less mature, so they're less efficient at processing bilirubin. Makes preemies more susceptible.
Okay, makes sense.
And sometimes there's a genetic predisposition. If it runs in the family, some babies might just be more likely to have higher levels. Then you have the causes that are, well, more alarming and need quick medical attention. Blood incompatibility is a major one. This happens if moms and babies' blood types clash, like Rh incompatibility or ABO incompatibility.
I never heard of that.
Yeah, it can cause the baby's red blood cells to be destroyed much faster, leading to a really rapid, dangerous spike in bilirubin. And critically, infections can also be a culprit. Things like sepsis, which is a serious blood infection, or meningitis, or even a urinary tract infection. These can stress the baby's system so much that the liver function is affected, leading to high bilirubin. Those are situations where you really need to act fast.
Wow. Okay. That's really important to know the range of possibilities.
Okay.
So we get the what and the why. Now, for parents, what signs should they actually be looking for? What tells them, okay, time to call the doctor? Because seeing that yellow can be unsettling.
You're right, the visual cue is often the first thing. The main symptom is definitely that yellowing of the skin and the eyes. And it helps to know how it typically progresses. It usually starts on the head, like the face, maybe the forehead or nose. Then if the bilirubin levels keep rising, it tends to move downwards, chest, belly, sometimes even the arms and legs.
Okay, good down.
Yeah. A simple check parents can do, often best in natural light, is to gently press on the baby's skin, say on the nose or forehead. If the skin looks yellow when you lift your finger, that's jaundice.
Good tip.
Beyond the yellow skin, there are other things to watch for, especially if it seems severe or might point to an underlying issue. One is dark yellow urine. Newborn pees should usually be really pale yellow, almost clear, especially if they're well hydrated. Darker, concentrated yellow could be a sign.
Okay.
Another really important one is pale colored stool. Newborn poop changes color, but if it's consistently pale, like chalky or white, that's a big red flag. It could indicate liver problems, which might be linked to that pathological jaundice. So the key thing for parents is, yes, some yellow might be normal, but how yellow, where it is, and any changes in urine or stool, those are crucial details to share with the pediatrician.
That's really practical advice. So if there is a concern, how do doctors figure out what's going on? How do they diagnose it for sure? And more importantly, what are the solutions? How do we fix this?
Great questions. Accurate diagnosis is key, obviously, to get the right treatment. The main way to measure bilirubin is a blood test. Simple blood draw gives a precise level. That number is then checked against charts based on the baby's age and hours and whether they were full term or preterm. That tells us if intervention is needed.
Okay, a direct measurement.
Yep. And if they suspect that blood incompatibility issue we talked about, they might do a Coombs test. That looks for antibodies attacking the baby's red blood cells, kind of like detective work. And in cases that are severe or go on for a long time, or if they suspect liver issues, they might do liver function tests just to check how well the liver is working overall. Now, for interventions, the good news is we have really effective treatments. The main one, the first line of defense usually, is phototherapy.
The blue lights, right?
Exactly, the Billy lights. The baby is placed under special blue or sometimes green lights. These lights work in a really cool way. They basically change the structure of the bilirubin molecule in the skin, making it water-soluble.
Oh, interesting.
Yeah. So instead of needing the liver to process it, this changed bilirubin can be flushed out easily by the body through urine and stool.
So the light literally transforms it so the body can just get rid of it easier.
Precisely. It's a way to bypass the liver's workload. It's very effective and avoids more invasive stuff in most cases.
That's amazing. What else helps?
Well, alongside phototherapy, or sometimes on its own if levels aren't too high, adequate feeding is crucial. Making sure the baby gets enough breast milk or formula helps keep things moving, literally. More feeding means more pooping, which is how bilirubin gets out.
Right, back to the output.
Exactly. If a baby is dehydrated, maybe from not feeding well, intravenous fluids might be given. Hydration helps the body flush things out more efficiently, and then, much more rarely, in really severe cases where bilirubin is dangerously high, and there's a risk of complications like brain damage, something called kernicterus, a blood transfusion, specifically an exchange transfusion, might be needed.
Okay.
This involves replacing some of the baby's blood with donor blood to rapidly lower the bilirubin and remove any harmful antibodies. But again, that's reserved for the most serious situations. The surprising truth is how well most babies respond to phototherapy and feeding support.
It definitely sounds like catching it early and starting treatment quickly is key, but are there things parents can do proactively, like steps to take before it becomes a bigger issue? Prevention is always better, right?
Absolutely, yeah. Prevention and early action are super powerful here. One of the most important things is just regular monitoring. And this isn't just at the doctor's office. Parents can learn to do that gentle skin check we talked about, pressing on the nose or forehead, ideally in daylight, just to keep an eye out for increasing yellowness,
Okay, being vigilant at home.
especially for preemies or babies with known risk factors. Just keeping an eye out can flag things early. Your pediatrician can guide you on how often to check. Another really protective thing is prompt breastfeeding. Starting breastfeeding within the first hour after birth, if possible, really helps.
Why the first hour specifically?
It helps get that colostrum into the baby, which acts like a laxative, helping clear out the meconium, that first dark stool, which is loaded with bilirubin. Establishing good feeding early on promotes those bowel movements needed to excrete bilirubin. It gets the system going right away.
Makes sense. Get things moving.
Exactly. And maybe the most empowering step, parental education. Just knowing the symptoms we discussed, understanding the different types, knowing when to call the doctor, that allows parents to get help early. Recognizing that yellowing skin or dark urine quickly means you can get your baby checked sooner, potentially preventing levels from getting dangerously high. So for you listening, that knowledge isn't just power, it's really protection for your baby. Which does make you think, right? How informed are we, and how can we empower ourselves even more?
Yeah, absolutely. So, pulling this all together, what does this mean for you, whether you're a new parent expecting or just caring for a newborn? It seems like hyperbilirubinemia, while it can sound scary, is mostly something that can be managed well.
That's exactly right. With prompt, accurate diagnosis and the effective treatments we have, like phototherapy, the vast majority of babies recover completely. They thrive, no long-term issues. Having the right knowledge empowers you to act fast, work with your pediatrician, and just ensure your baby gets the best care.
It really does highlight how vital that partnership with your pediatrician is, and just attentive care overall. It makes you think, doesn't it? How much difference can that early awareness and quick call to the doctor make? Not just for this, but for your child's whole health journey. Being prepared, knowing who to turn to, it's huge. Well, that brings us to the end of another really insightful discussion here on Have More Babies. Thank you so much for joining us. Now, for more in-depth information on newborn health, pediatric care, and specifically more details about hyperbilirubinemia, we really want to point you towards omegapediatrics.com. They have a fantastic website with a wealth of knowledge, articles, services like preventative care, lactation support. They have several locations in Georgia or Roswell, Alpharetta, Milton. You can find detailed info, book appointments, and just learn more about their whole approach to keeping kids healthy. Really, check out omegapediatrics.com.
Visiting omegapediatric.com is definitely a great next step. It's a fantastic resource to explore these topics more and connect with expert care focused on your child.
And hey, if you found this chat valuable today, please do us a favor. Like this video, subscribe to our channel so you don't miss future episodes of Have More Babies. And please share it. Share it with any expecting parents, new parents, grandparents, anyone who might benefit from knowing this. Until next time, stay curious and keep learning.
Goodbye.